1 in 3 people over 60 is accidentally overdosing on vitamins right now, and they have no idea their organs are quietly failing.
Michael, that number shocked even me. In Japan, we see this differently. We ask why Americans need so many pills in the first place.
Because we're trying to fix deficiencies, Hiroshi. Blood tests show low vitamin D, low calcium, low iron, so we supplement. That's evidence-based medicine.
Or evidence-based profits. Tell me, when did humans evolve to need 30 pills a month to survive? Our ancestors thrived without pharmacies.
Our ancestors also died at 40, from infections we now cure with antibiotics. You can't romanticize the past when it comes to longevity, my friend.
Fair point. But there is wisdom in their food-first approach. Today's topic terrifies me because I have seen the damage with my own eyes.
Agreed. And I'm going to show you exactly which 4 vitamins are sending seniors to the emergency room, starting with one that almost everyone over 60 takes daily.
Before we name them, let me tell you about Margaret. She was 67, took her calcium religiously for bone health every single morning without fail.
Let me guess. She ended up with kidney stones? That's the classic calcium overdose presentation I see in my practice all the time.
Worse. 3 years of faithful calcium supplementation, and then one morning she had a massive heart attack that nobody saw coming at all.
Wait, heart attack? From calcium? Hiroshi, that doesn't make immediate sense unless... Oh no, arterial calcification. Was that confirmed on imaging?
Her cardiologist found severe calcified arteries. The supplement she trusted to protect her bones had essentially turned her blood vessels into stone over time.
This is exactly why I tell patients that calcium supplementation after 60 is a dangerous gamble unless you're doing it with magnesium and vitamin K2.
But the bottle just said calcium for bones. She trusted the label. She trusted the health store. Nobody warned her about arteries.
And that's the first deadly mistake. Taking calcium without understanding where it actually goes in your body when you're over 60 years old.
So explain the mechanism to our viewers. Why does calcium suddenly become dangerous after a certain age? What changes in our body?
After 60, your body loses its ability to properly direct calcium to bones. Instead, calcium starts depositing in soft tissues, arteries, kidneys, even heart valves.
In traditional Japanese medicine, we say the body's rivers begin to carry stones. Your Western science just confirmed our 1,000-year-old metaphor with imaging technology.
I hate when you do that, Hiroshi. You can't just claim ancient wisdom predicted modern pathophysiology. Show me the Japanese texts about arterial calcification.
The texts speak of rigid vessels and hardened pathways in elders. They did not have CT scans, but they observed the same clinical outcomes we see today.
Observation isn't mechanism. But fine, let's agree calcium is dangerous. The question is, how much is too much for someone over 60?
Any supplemental calcium is too much if you are eating dairy, leafy greens, or fish with bones. Food calcium comes with natural cofactors that direct it properly.
That's too absolute. Some seniors have genuine malabsorption issues, osteoporosis, or dietary restrictions. They need supplementation, but it must be done correctly with monitoring.
Then why do most doctors just write the prescription without checking magnesium levels, vitamin K2 status, or existing arterial health first?
Because the system is broken, Hiroshi. 10-minute appointments don't allow for comprehensive metabolic panels and patient education about cofactors and timing.
So we agree the system pushes pills without proper guidance. Margaret paid for that system failure with her life and her family's heartbreak.
Yes, and she's not alone. But here's what really keeps me up at night. Calcium isn't even the worst offender on our list today.
Before we move to the second vitamin, tell me, if someone is taking calcium right now, what should they do immediately when they finish watching this?
Stop taking it unsupervised. Book a coronary calcium scan, check your magnesium and vitamin K2 levels, and talk to a doctor who understands nutrient interactions properly.
And if they cannot afford all those tests, many seniors live on fixed incomes and must choose between food and medical testing, unfortunately.
Then they switch to food sources immediately: sardines with bones, leafy greens, and dairy if tolerated. Food calcium has never caused arterial calcification in studies.
Finally, we agree completely. Food first, always. Nature packages nutrients with their cofactors built in, like a perfect formula designed over millions of years.
All right, moving to vitamin number 2. And this one makes calcium look tame. We're talking about iron. And the overdose epidemic nobody is discussing openly.
Iron terrifies me more than calcium because the damage is invisible until your liver is already failing. I have seen this in 3 patients this year alone.
The problem is that after menopause, women stop losing blood monthly, so their iron needs drop dramatically. But they keep taking the same supplements they took for decades.
And men over 60? They never needed extra iron in the first place, yet multivitamins push 18 milligrams into their bodies daily without any medical justification.
Excess iron becomes a free radical generator. It oxidizes tissues, damages DNA, and specifically targets the liver and heart with cumulative toxicity over years.
In Japan, we test ferritin levels routinely in elders. In America, doctors assume more is better and never check if the patient is already iron-loaded dangerously.
That's not entirely fair, Hiroshi. Some American doctors do check ferritin, but you're right that it's not standard protocol like it should be for everyone.
I had a patient, Robert, 72, who felt fatigued and assumed he needed more iron. He took supplements for 2 years without testing first.
Let me guess. His ferritin came back over 500 when we finally tested it. And his liver enzymes were climbing into dangerous territory, slowly.
630. His liver was screaming, but he thought the fatigue meant he needed more iron, not less. The irony is painful.
This is why I tell every patient over 60, never take iron without a blood test confirming deficiency first. The risk-benefit ratio is completely upside down.
But the multivitamins do not require prescriptions. Anyone can buy them and assume they are safe because they are sold in bright, happy packaging at every store.
And that's the regulatory failure. Iron supplementation after 60 should require a prescription based on lab work, but instead it's marketed as wellness and vitality.
So what is the safe upper limit for someone over 60 who actually does have confirmed iron deficiency and genuinely needs supplementation?
18 milligrams daily maximum, and only until ferritin normalizes, then stop completely. Most seniors need 0 supplemental iron if they eat meat or fish regularly.
And for vegetarians over 60 who refuse animal products, do they face different risks, or does plant iron behave more safely in the body?
Plant iron is non-heme iron, which is less absorbable, so it's somewhat safer. But even vegetarians can overload if they're taking high-dose supplements unnecessarily for years.
This brings us to the testing question. How often should someone over 60 check their ferritin levels if they are taking any iron at all?
Every 6 months minimum while supplementing, then annually for maintenance monitoring. Ferritin creeps up slowly, so you need regular surveillance to catch problems early.
That is more testing than most seniors do for anything. The system does not make this easy or affordable, which means people are flying blind.
You're absolutely right. And that's why I'm so aggressive about telling people to just stop taking iron unless they have a confirmed need with documentation.
Agreed. Now let us talk about vitamin number 3, vitamin A, because this one surprises people the most when I tell them it is dangerous.
Vitamin A toxicity is insidious because it builds up in your liver over months or years. You feel fine, then suddenly you're in liver failure without warning.
The recommended daily allowance is 3,000 international units for men, 2,300 for women. But one multivitamin gives you 5,000 or more.
And people think more is better for vision and immune system. So they take 2 multivitamins, plus a separate vitamin A supplement on top of that.
I had a patient doing exactly this. She was taking 15,000 international units daily because she read online it would prevent age-related macular degeneration completely.
Did she develop hypervitaminosis A symptoms? The classic presentation is bone pain, nausea, dizziness, and eventually severe liver damage if it continues long enough.
She came to me with bone pain and blurred vision, ironically. The vitamin she was taking to protect her eyes was poisoning her liver and bones simultaneously.
This is the cruelty of vitamin A toxicity. It mimics deficiency symptoms, so people think they need more when they're actually overdosing already.
Her liver enzymes were 4 times normal when we finally tested them. She could have progressed to cirrhosis if we had not caught it at that moment.
And here's what makes me furious. Beta-carotene from food never causes toxicity because your body converts only what it needs into active vitamin A naturally.
Carrots, sweet potatoes, spinach. Eat these freely and you will never overdose. But the pills bypass your body's intelligent regulation system completely and force excess storage.
So the rule for vitamin A after 60 is simple. Stop supplementing unless you have a confirmed deficiency documented with blood work from a qualified doctor.
And if you are taking a multivitamin, check the label. If it contains more than 3,000 international units of preformed vitamin A, throw it away immediately.
Better yet, switch to a multivitamin that uses only beta-carotene instead of retinol palmitate or retinol acetate. Your liver will thank you for decades.
Now we reach the 4th and final vitamin on our dangerous list, vitamin E, and this one has a particularly cruel twist for seniors.
Vitamin E is marketed as a harmless antioxidant that protects your heart and brain from aging damage. Sounds wonderful, right? Except it thins your blood significantly.
And many seniors over 60 are already taking aspirin or blood thinners for heart disease or stroke prevention prescribed by their cardiologists for protection.
When you combine vitamin E with these medications, you create a bleeding risk that can turn a minor injury into a life-threatening hemorrhage instantly.
I had a patient, James, 68, who was taking vitamin E, aspirin, and fish oil simultaneously. He thought he was protecting his heart with this combination.
That's a triple blood thinning stack. 1 fall, 1 dental procedure, 1 stomach ulcer. Any of these become catastrophic when your blood won't clot properly at all.
James fell in his garden, hit his head on a stone, and developed a subdural hematoma that required emergency surgery to prevent permanent brain damage.
And the surgeon probably asked him about blood thinners. But did James even know that vitamin E counts as a blood thinner? Most patients have no idea.
He told the surgeon about his aspirin and warfarin, but forgot to mention his vitamin E supplement because he thought vitamins were separate from real medicine.
This is the deadly assumption, that because something is sold over the counter without a prescription, it must be completely safe and free of drug interactions.
The surgery went well, but his recovery was complicated by bleeding. The surgeon later told him that vitamin E nearly cost him his life during that operation.
So here's the critical rule for anyone over 60. If you're on any blood thinner, including aspirin, you must stop vitamin E supplementation immediately, today.
But Michael, vitamin E is in almost every multivitamin and anti-aging supplement marketed to seniors. How can people avoid it when it is everywhere?
You read every label carefully. If you're on blood thinners, you need a multivitamin without vitamin E, or you skip multivitamins entirely and get nutrients from food.
And what about the studies that claimed vitamin E prevents heart disease and Alzheimer's disease? Were those studies completely wrong from the beginning?
Those studies were observational, meaning they showed correlation, not causation. Later randomized controlled trials found no benefit and actually showed increased mortality risk in some groups.
So we sold millions of seniors a supplement based on hope and correlation, not on solid evidence. And now we are seeing the consequences decades later.
Exactly. And the frustrating part is that vitamin E from food, nuts, seeds, vegetable oils, has never shown these risks because the doses are physiological, not pharmacological.
Once again, we return to food first. Nature provides vitamin E in safe amounts, packaged with other nutrients that balance its effects on blood clotting naturally.
I'm not going to argue with that, Hiroshi. On this point, your traditional approach is vindicated by modern research, repeatedly and consistently across multiple studies.
So we have covered 4 vitamins: calcium, iron, vitamin A, and vitamin E. But I know our viewers are thinking, what can they take safely?
That's the question I get every single day in my practice. People want a simple list of safe supplements, but the answer is more nuanced than that.
Let us start with what almost every senior over 60 genuinely needs: vitamin D. This is the one supplement I actually recommend to nearly all my patients.
Agreed, but with testing. You need to know your baseline vitamin D level before supplementing, and you need to monitor it every 6 months at minimum.
Most seniors I test come back between 20 and 30 nanograms per milliliter. Optimal is 40 to 60, so supplementation makes sense for the vast majority.
2,000 international units daily is safe for most people, but some need 4,000 based on their levels and body weight. This requires individualization, not guessing.
And vitamin D must be taken with vitamin K2 to ensure calcium goes to bones, not arteries. This is critical and often ignored by doctors prescribing vitamin D.
You're absolutely right. Vitamin D increases calcium absorption, so without K2, you're potentially accelerating arterial calcification that we discussed earlier with Margaret's case.
The second supplement I recommend is magnesium. Most Americans are deficient because modern soil is depleted and processed food contains almost none at all.
Magnesium glycinate or magnesium threonate are the best forms. 300 to 400 milligrams daily helps with sleep, muscle cramps, blood pressure, and heart rhythm.
And magnesium protects against the calcium problems we discussed earlier. It is the natural balancer that keeps calcium in bones rather than soft tissues throughout the body.
Third on my list is omega-3 fatty acids from fish oil or algae oil for vegetarians. 2 grams daily of EPA and DHA combined for heart and brain health.
But here is the warning. Fish oil also thins blood, so if you are on blood thinners, you must tell your doctor before starting this supplement.
Correct. This is exactly why I tell patients to bring every supplement bottle to their doctor visits, even the ones they think are harmless and insignificant.
The fourth supplement I cautiously recommend is B12, especially for vegetarians or people taking metformin for diabetes management. Deficiency causes irreversible nerve damage over time.
B12 is water-soluble, so toxicity is nearly impossible. 1,000 micrograms daily is safe, and some people need injections if they have absorption issues from age or medications.
Now let me ask you directly, Michael, do you personally take any supplements yourself? Practice what you preach, or are you supplement-free like our ancestors?
I take vitamin D 3,000 international units with K2, magnesium 400 milligrams at night, and omega-3 2 grams daily. That's it. 3 supplements total.
And I take only vitamin D in winter months when sun exposure is insufficient. The rest comes from my diet: fish, vegetables, fermented foods, seaweed, miso.
Which brings us to the real solution for most seniors. Improving diet quality first, before reaching for supplements to fill gaps that might not even exist.
But we live in a world where people want quick fixes. Take a pill, feel better, avoid the hard work of changing eating habits and lifestyle patterns.
And that's why we have this epidemic of supplement overdosing. People think they're taking shortcuts to health, but they're actually creating new problems instead of solving old ones.
So let me give our viewers a practical framework. Before taking any supplement, ask yourself 3 questions. Are you ready to hear them and apply them honestly?
Question 1. Do I have a confirmed deficiency documented with blood work from a qualified healthcare provider? Or am I just guessing based on symptoms?
Question 2. Am I taking any medications or other supplements that could interact dangerously with this vitamin? Have I checked interactions thoroughly with a pharmacist?
Question 3. Can I get this nutrient from food instead? And if the answer is yes, then food should always be the first choice before supplementation.
If you cannot answer yes to question 1, or if you answer yes to question 3, then you probably do not need that supplement at all.
And if you're already taking supplements, bring every bottle to your next doctor visit. Get blood work to check if you actually need them or if you are overdosing.
This conversation has been difficult because we are challenging beliefs that people have held for decades about vitamin safety and necessity for health.
But it's necessary. Margaret's heart attack, Robert's liver damage, the bleeding risks. These are real people suffering real consequences from supplements they thought were helping them.
The supplement industry has done brilliant marketing. They have convinced millions that more is better, that everyone is deficient, and that their products are essential for life.
And to be fair, some people do need supplements. But the majority are taking things they don't need, in doses that are harmful, without any medical supervision or monitoring.
So our message today is not anti-supplement. It is pro-wisdom, pro-testing, pro-food first, and pro-individualization, rather than one-size-fits-all protocols that ignore biochemistry.
If you take away one thing from this episode, let it be this. Stop assuming supplements are safe just because they are natural or over-the-counter.
And start asking your doctor to test you before, during, and after supplementation. Your body will tell you through blood work what it truly needs, not advertisements.
We've covered calcium destroying arteries, iron poisoning livers, vitamin A causing bone pain and liver failure, and vitamin E creating bleeding risks with blood thinners.
These 4 vitamins have sent countless seniors to emergency rooms over the past decade. The tragedy is that most of this suffering was completely preventable with education.
So here's what I want you to do after watching this episode. First, gather all your supplements and write down every ingredient and dose clearly on paper.
Second, book an appointment with your doctor and bring that list. Ask for blood work to check if you actually need everything you are taking daily.
Third, eliminate any supplement with calcium, iron, vitamin A over 3,000 international units, or vitamin E if you're on blood thinners. Do this today, not tomorrow.
Fourth, focus on improving your diet. Eat 30 different plant foods per week, include fish twice weekly, and prioritize colorful vegetables at every meal without exception.
And fifth, if you're going to supplement, do it intelligently with testing and monitoring. Vitamin D with K2, magnesium, omega-3, and B12 if needed are the core 4.
Before we continue, I want to address something important. Some viewers might feel overwhelmed or scared right now after hearing about these dangers repeatedly.
That's a valid concern, Hiroshi. Fear without action is paralysis. Fear with education becomes empowerment. So let's shift from what not to do to what to do instead.
Exactly. Let us talk about the positive steps that will actually improve health outcomes, rather than just avoiding dangerous supplements as our only strategy.
The foundation is always blood work. I cannot stress this enough. You cannot manage what you do not measure. Testing removes guesswork and prevents both deficiency and toxicity.
In my practice, I run a comprehensive panel for every patient over 60. Vitamin D, magnesium, ferritin, B12, calcium, and a complete metabolic panel annually at minimum.
That panel costs about $200 without insurance, sometimes less. Compare that to the cost of treating a heart attack or liver failure from supplement overdose later.
Prevention is always cheaper than treatment, yet our healthcare system rewards treating disease rather than preventing it through proper nutrition and testing protocols.
Which brings me to insurance companies. Many will cover these tests if your doctor codes them correctly as preventive care or uses appropriate diagnostic codes.
So do not assume you cannot afford testing. Ask your doctor to work with your insurance. Appeal denials. Fight for preventive care coverage that you deserve.
Now let's talk about the food-first approach practically. What does a supplement minimizing diet actually look like on a plate 3 times per day consistently?
Breakfast could be eggs with spinach and avocado. Lunch is salmon with mixed vegetables. Dinner might be chicken with sweet potato and broccoli. This covers most nutrients naturally.
Add in nuts, seeds, berries, and fermented foods like yogurt or kimchi, and you've built a nutrient-dense foundation that eliminates 90% of supplementation needs immediately.
But Michael, many seniors struggle with appetite, digestion, or meal preparation. They live alone, have limited mobility, or simply lack motivation to cook elaborate meals daily.
Fair point. Then we focus on nutrient density per bite. A smoothie with protein powder, berries, spinach, and chia seeds delivers massive nutrition in one easy glass.
Or a simple soup with bone broth, vegetables, and beans. Make a large batch, freeze portions, and you have ready nutrition for weeks without daily cooking effort.
The key is removing barriers. If cooking is hard, use meal delivery services designed for seniors. If chewing is difficult, focus on soft foods and smoothies.
If budget is tight, prioritize the most nutrient-dense affordable foods: eggs, canned fish, frozen vegetables, lentils, and seasonal produce from local markets.
These foods cost less than supplement bottles and provide far superior nutrition with bioavailability that pills cannot match through any manufacturing process available today.
Now I want to share another patient story that illustrates the transformation possible when someone commits to this food-first philosophy with genuine dedication.
I'm listening. You've got that look like this story is going to challenge my Western protocols again and make me reconsider some assumptions I hold dear.
Her name was Dorothy, 83 years old. She came to me taking 14 different supplements daily, spending over $200 monthly on bottles and pills.
14 supplements. Let me guess. Multivitamin, calcium, vitamin D, fish oil, CoQ10, probiotics, turmeric, and 7 others that someone recommended or she read about online.
Exactly that list. She was exhausted, having stomach pain, and her labs showed elevated liver enzymes that nobody could explain for months of investigation.
And you stopped all the supplements at once? That's risky, Hiroshi. You could have caused rebound deficiencies or withdrawal effects from sudden cessation of everything simultaneously.
I did stop them all, and within 3 weeks her energy returned completely, stomach pain vanished, and liver enzymes normalized perfectly. The supplements were poisoning her slowly.
That's a dramatic result, but you can't generalize from one case. Maybe she had a specific sensitivity or interaction that most people wouldn't experience at all.
Perhaps. But I have repeated this experiment with 20 more patients since Dorothy. 18 of them felt significantly better off supplements than on them within 1 month.
That's actually compelling data for a case series. Have you published this? This kind of deprescribing research is exactly what we need in geriatric medicine right now.
Not yet, but I am working with a university team to design a proper randomized trial. We need evidence, not just my clinical observations and patient testimonials.
I would love to see that published. It would challenge the entire supplement industry narrative and give doctors permission to question polypharmacy and vitamins too, not just medications.
Dorothy now takes only vitamin D and magnesium. She eats fish, vegetables, and fermented foods daily. Her health at 83 is better than it was at 75.
This is the model we should be teaching medical students. Less is often more. Food beats pills, and testing beats guessing. Every single time, without exception.
But the system rewards prescribing, not deprescribing. Doctors get 15 minutes per patient. It is faster to write a supplement recommendation than to teach nutrition for 30 minutes.
You're right, and that's a systemic problem I can't fix alone. But we can educate people through platforms like this to advocate for themselves and demand better care.
Which brings me to our next critical topic: how to talk to your doctor about supplements without seeming confrontational or like you are questioning their expertise disrespectfully.
Start by bringing your supplement bottles to the appointment. Say, I want to make sure these are still appropriate for me. Can we review them and test my levels?
If your doctor dismisses your concerns, ask directly, when was the last time my vitamin D, magnesium, iron, and vitamin A levels were checked? Can we test them today?
Most doctors will respect that question and order the tests. If they refuse without good reason, that's a red flag that you might need a second opinion from someone else.
And if testing reveals you are overdosing on something, do not feel guilty or ashamed. You were doing what you thought was right based on limited information available.
The important thing is that you're catching it now, before permanent damage occurs. Liver damage, arterial calcification, bleeding events, these can often be prevented if found early.
Now, I know some viewers are thinking, if I stop my supplements, what will happen to me? Will I suddenly become deficient and sick immediately after stopping?
The honest answer is that if you're eating a reasonably good diet with protein, vegetables, fruits, and whole grains, you probably won't notice any difference at all.
Your body has stores of most vitamins that last weeks or months. Vitamin B12 stores last years in the liver. You are not going to collapse from stopping supplements.
The exception is vitamin D in winter, if you live in northern latitudes. That one you might want to keep during the dark months, but test your levels to confirm.
Everything else, try a 30-day supplement vacation while focusing on food quality. Track how you feel. Many people report feeling better, not worse, when they stop the pills.
And if you do feel worse, that's valuable information. It might mean you genuinely need that supplement, or it might be placebo effect. Blood work will tell you which.
This is empowerment through experimentation. Your body is the laboratory, food is the intervention, and blood tests are the objective measurement of results over time.
I love that framing, Hiroshi. It puts the patient in control while still using scientific methods to validate decisions. That's the best of both our approaches combined perfectly.
Before we finish, let us talk about the elephant in the room. The supplement industry is massive and powerful. Will they be angry with us for this episode?
Probably. But our job isn't to protect industry profits. It's to protect patient health using evidence and clinical experience. If that makes us unpopular, so be it.
I agree completely. The backlash will come, but if we save even one Margaret from a heart attack or one Robert from liver failure, this conversation was worth it.
And to be clear for the supplement companies watching, we are not saying all supplements are bad. We are saying unmonitored, untested, excessive supplementation after 60 is dangerous.
The companies that do responsible marketing, appropriate dosing, and encourage testing before and during use, those companies are part of the solution, not the problem we address.
But the companies selling mega-dose multivitamins with 5,000 international units of vitamin A and 18 milligrams of iron to seniors without testing, they need to change.
Let me end with a question for you, Michael. If you could wave a magic wand and change one thing about supplement regulation, what would it be?
I would require prescription-only status for any supplement exceeding 50% of the recommended daily allowance for fat-soluble vitamins and iron after age 60. That would prevent most overdoses.
Interesting. I would require mandatory labeling that says, "Have you been tested for deficiency? Taking this without testing may cause harm. Consult your healthcare provider immediately."
Both good ideas, but neither will happen because the supplement lobby is too powerful, and regulations favor industry over consumer protection in most countries, unfortunately.
Then our responsibility is to educate people directly so they can protect themselves. Knowledge is power when the system fails to protect vulnerable populations adequately.
All right, let's wrap this up with clear action steps. If you're over 60 and taking supplements, here's your homework for the next 7 days, starting immediately.
Day 1. Inventory every supplement you take. Write down the name, dose, and why you started taking it originally. Be honest about whether you remember the reason.
Day 2 and 3. Research each supplement for interactions with your medications. Use a reliable database like drugs.com or ask your pharmacist to review everything together.
Day 4. Call your doctor's office and request blood work. Ask for vitamin D, magnesium, iron panel with ferritin, vitamin B12, and calcium levels at minimum.
Day 5. While waiting for the appointment, start tracking how you feel. Energy, sleep, digestion, mood. Write it down daily so you have objective data.
Day 6. Evaluate your diet honestly. Are you eating fish, vegetables, nuts, seeds, whole grains? Or is your diet processed foods and supplements compensating for poor nutrition?
Day 7. Make a decision. Based on what you've learned this week, which supplements will you continue, which will you stop, and which need testing before deciding?
This 7-day process puts you in control of your health rather than passively trusting marketing claims or outdated advice that no longer serves your body's current needs.
And remember, this is not about perfection. It's about awareness and gradual improvement. Small changes, sustained over months, create massive health transformations over years of consistency.
We have covered a lot today. 4 dangerous vitamins, the testing you need, the supplements that are actually helpful, and the food-first philosophy that should guide decisions.
If this episode scared you, good. Fear is appropriate when you learn you've been accidentally overdosing on something for years, but fear should drive action, not paralysis.
Talk to your doctor, get tested, adjust your approach, and give your body time to rebalance naturally. Your organs will thank you, your energy will improve, and longevity increases.
One final thought. The supplement industry has spent billions making you believe you're deficient and broken. You're not. You're human, and humans thrived for millennia eating food.
Trust your body's wisdom, feed it real food, test, don't guess, and supplement only what's truly needed based on evidence. That is the path to healthy aging with vitality.
Thanks for watching, everyone. Share this episode with someone over 60 who needs to hear this message. It might literally save their life or prevent serious health complications.
Until next time, eat well, test regularly, question everything including us, and remember that less is often more when it comes to supplements after 60. Stay healthy, stay wise.
And if you're unsure about anything we discussed today, re-watch this episode, take notes, and bring those notes to your doctor. Use us as a conversation starter for better care.
Be well, be informed, and be empowered to make decisions that serve your unique body's needs. Not the needs of industry, not marketing, but your needs alone.
This is Michael Harris reminding you that evidence-based medicine means testing before treating, and food before pills whenever possible in your daily health routine.
And this is Hiroshi Saito reminding you that ancient wisdom and modern science agree. Nature provides what we need if we are wise enough to listen carefully and eat mindfully.
See you in the next episode, where we tackle another controversial health topic that nobody wants to discuss openly, but desperately needs honest conversation and evidence-based analysis.
Until then, take care of yourselves and each other. Health is wealth, and knowledge is the first step toward reclaiming control over your well-being in this confusing medical landscape. Goodbye.